Hello, my name is Samik Patel and I'll be presenting our study today entitled Local Regional Anesthesia Coupled with Dexmedetomidine as a Safe, Effective Anesthesia Modality for Carotid Endarterectomy. We have no conflicts of interest to report related to this research. Dexmedetomidine, also known as Precedex, has both analgesic and amnesic properties and is reported to be a safe and acceptable alternative to conventional general endotracheal anesthesia. And so our primary objective for the study was to compare the immediate, during hospitalization, and short-term, within 30 days of hospitalization, postoperative outcomes in patients who underwent carotid endarterectomy using general endotracheal anesthesia versus local regional anesthesia alone versus dexmedetomidine with local regional anesthesia at a single institution. This was a retrospective cohort study from January 2015 to December 2019 at St. Joseph Mercy Ann Arbor using the Blue Cross Blue Shield of Michigan Cardiovascular Consortium database and Michigan Data Analytics database. Patients were stratified into three groups based on anesthesia type provided for the operation. Primary outcomes included stroke, myocardial infarction, and death. Patient demographics were characterized and adjusted using propensity score weighting. 384 patients met inclusion criteria. 187 patients in the general endotracheal anesthesia group, 66 patients in the dexmedetomidine plus local regional anesthesia group, and 131 patients in the local regional anesthesia group. There was no significant difference in covariate comparisons across the anesthesia groups. All three groups were well balanced after propensity score weighting. There were no significant differences across anesthesia groups and primary outcomes of stroke, MI, and death during the admission. The general endotracheal anesthesia group had significantly longer length of stay compared to the dexmedetomidine and local regional anesthesia group and the local regional anesthesia only group. However, there was no significant difference in hospital length of stay between the dexmedetomidine and local regional anesthesia group and local regional anesthesia only groups. There was no difference in readmission rates within 30 days between the dexmedetomidine and local regional anesthesia group and local regional anesthesia only groups. There was no significant difference between strokes, MI, or death within 30 days between all three of the anesthesia groups. We also found no significant difference in postoperative pain scores when comparing the general endotracheal anesthesia group to local regional anesthesia, as well as between local regional anesthesia and dexmedetomidine and local regional anesthesia groups. This table presents propensity-weighted outcome comparisons. There are no significant differences across the groups in the primary outcome of death, stroke, or MI during admission. The general anesthesia group had significantly longer length of stay than the local regional anesthesia and dexmedetomidine group and the local regional anesthesia only groups. However, there was no significant difference in hospital length of stay between the dexmedetomidine and local regional anesthesia group and local regional anesthesia only groups. There was no difference in readmission rates within 30 days between the dexmedetomidine and local regional anesthesia and local regional anesthesia alone groups. There is no significant difference between strokes, MI, or death within 30 days between all three of the anesthesia groups. We also found no significant difference in postoperative pain scores when comparing the general endotracheal anesthesia group to the local regional anesthesia, as well as between local regional anesthesia and dexmedetomidine in addition to local regional anesthesia groups. In conclusion, the use of dexmedetomidine in addition to local regional anesthesia is a safe and acceptable alternative to conventional general endotracheal anesthesia or local regional anesthesia alone in carotid endarterectomy with similar rates of immediate and short-term complications as well as postoperative pain scores. Thank you for your attention.